Bryce. Waiting on him to respond here. Awesome. Hi, Bryce. How are you doing?
Hey, how's it going? I'm doing pretty well. How's everybody in the chat?
I am awesome. I hope our viewers are awesome. I just watched your unboxing video of your stethoscope, of your messenger bag, and your white coat. So that was so awesome. I loved it. Were you expecting that?
No, I knew noticed it was a really large package, so I assumed it would be more than the white coat, but I was definitely impressed by what they gave me, and you should have seen the faces that my parents had as well. We were just blown away by LA Care's generosity.
Awesome, awesome. So glad you received that. Let's hop into today. I have a few questions for you. If we have time, we can take some questions from those that are in our audience that are watching. And so the first question I want to ask you is, what was your initial reaction to you hearing that you had received the LA Care Elevating the Safety Net Scholarship Award this year?
Whew. So it still feels unbelievable to me. Like, I think it was always a dream to be able to go to medical school and have it paid in full. So when I got the call and was told about it, I was just like, it just took a while to sink in. Like, really, are you calling the right? Is there more than one Bryce Bentley? From Charles Drew, and so it was just this wave of disbelief.
Yeah,
But
yeah.
really like settle in until I got the email. And so I didn't tell
Mm,
my parents until I got the email because I wanted something, settled to get them all the information and everything. And I intentionally waited for my dad's birthday. And so we
oh,
were just in the living room. Yeah, I wanted it to be a nice surprise. So we're chilling in the living room and I just emailed my dad saying like, oh yeah, I'm applying for the scholarship. I want you to take a look at it. And so then he's just going on there. He's like, oh, okay, yeah. Yeah. It's like, wait, what? What? And then he just like stands up and then he's like shouts at the news. And then we're all just like standing up and yelling and everything like that. So it was really,
wow.
that's when it sort of like sunk in like, yes, you've been given this opportunity and that there are people that are invested in, my own growth and my ability to go through this journey in a convenient and healthy manner.
Absolutely. I love that. And to surprise him on his birthday. So tell us, what does this full ride scholarship mean for you and your family? What type of help would the scholarship actually provide for you all?
It's an incredible achievement, not only for me, but also for my family and for the community that I came from. Growing up, I've always had mentors within my church, within my schools, my teachers, my coworkers, my peers, my friends. And this is sort of like a testament to all of the things that they've done for me, instilling the idea that service is at the most importance and that whatever you do, whether it would have been like medicine or working in other fields, that to always give it your best and do it for the people that are involved. And so, and especially for my family, I'm one of four siblings, and we've all gone off and done our own thing, whether my brother in his business or my sister going to college and also being a track athlete and my sister and raising oldest sister raising her family and working in a bank and doing all sorts of things. And
Nice.
so I just wanted to shout out my parents that they've done a great job in raising us and instilling us values of hard work. And so
Absolutely.
this sort of I like to think of it as they're the ones who earned the scholarship because it's through their instilling of the values that I get here.
That's incredible. I love that you attribute your this huge milestone, I guess, to your parents and those that have been a part of raising you and essentially mentoring you into the man that you are today. So I think that's extremely incredible. Kudos to that village that played a huge part into this moment. So I just want to ask you, what event or events, maybe there's more than one, that led you into medicine as a career?
Okay. So yeah, I wouldn't attribute it to one particular thing. I think growing up, a lot of my family members have suffered through various health issues, particularly cardiovascular diseases or certain afflictions. And so that's sort of when it started popping in my head about, oh, got to watch our health, especially as we get older. And it wasn't until my grandmother died where she was in the hospital for several days, and that sort of made me realize like what goes into being in the medical field, the workers who are caring not only towards the patients but towards the family as well, and sort of what the family's feelings during that instance. And so medicine is just not like a scientific like, oh yeah, you tested positive for these things, or oh, you fulfill these categories. It's about the human aspect and looking more into what their overall situation is. And so once
Yeah,
I realized that, there's both a social component towards it, and you can connect on a personal level. I knew, and I also love science growing up, so I knew like, yes, this is something that I want to look more into, and then the journey just takes off from there.
absolutely. No, that's awesome. And so, what are you expecting? During this era of COVID-19, there's probably going to be a lot of virtual classes. So, what are you expecting during this season as you enter into medical school in your first year?
I think that it's going to require a lot of flexibility.
Oh, absolutely.
Um,
Awesome.
Going from, so I took a 1 year, a gap year, like my peers like to call it, an enrichment year to build ourselves and our characteristics.
Nice.
But I feel that going from being in class, attending lecture, and then going towards being online and not being able to see all my peers present and having that feeling of walking into a large classroom and being
Yeah.
centered around like the atmosphere, I think it's just going to take a lot of adjustment and gonna try and experiment on what works best for me as well as my peers.
Yeah.
But I do think it will be it's a really great way to connect with technology in a way, since the era of COVID has definitely proves that technology needs to be looked upon and viewed as important, because this is the way that doctors are interacting with patients. And if we become comfortable with that sort of technology, who knows how it's going to be in the future. So
Yeah.
it's a necessary thing that has to happen, going through online. But I'm excited for it. I think we'll be able to manage.
Yeah, yeah. And I think you bring up a really good point because right now, during this season of the pandemic that we're in, technology has played a huge role. I mean, even for us to have this platform to communicate with each other and to, allow, each other to really kind of share information through these platforms are incredible. And so I definitely feel like technology is going to play a huge role. And I know while you're in medical school, you'll be using lots of it. I'm
Yeah,
sure talking about telehealth and what that looks like for you all post COVID. And so I think that's awesome that you have a good perspective and you're open to it and you're excited about, the technology piece of that for, virtual classes. So next question, you have an array of experiences. Reading your bio, I was blown away. I just am curious to know, out of all of your healthcare experiences, which one are you most proud of?
yeah. It's a very good question. It's definitely it's really hard for me to pick because I've been thinking about this a lot lately. And if I
Yeah.
was to quickly share my experiences, what would I talk about? And I would say one of the experiences I'm most proud of is the working in the Black Health Project at UCLA, or previously known as Black Hypertension Project.
Mhm.
And it was really personal because we went out into the community, and not just like any community. We went back to the community where I grew up in, the Crenshaw Lamert Park area. And so we were doing health presentations, health fairs at churches, at different areas and parks, and just being able to interact with the residents and convey different informations about hypertension and dangers of cardiovascular diseases, diabetes, and various other things. So that in particular gave me a personal connection. I was able to even present or organize a little health gathering, a health fair at my church, Phillips Temple See Me Church. And so that sort of let me connect with my own like community members and be able to give back in a way that I wasn't able to before. And so that's sort of what I want to do when I am become a physician, is to be able to work in my community and in different communities, but particularly to serve those who have been in similar situations as myself, and one that we can both relate to and have that personal connection.
Got it, got it, got it. That's awesome. I know we do have a few questions from the viewers here, so I'm gonna pop up a few of them. Some of them are very similar to what I was gonna ask you. So there's one there. Who inspires you? Let us know who has inspired you throughout your life.
Oh, that's a good one. I think so. As mentioned, that how the whole community that I've been in has inspired me, but to give a particular one, I would say my parents have been one of the most inspirational figures in my life, just because all that they've done for us, and you know, growing up and raising like so many children, it's definitely hard, and they've done many different things to support us, whether it's going to sporting events, making sure that we have all the things we need, supplies, getting a proper education, and just being really patient when maybe we've caused a little bit of trouble or we weren't able to uh, exceed our expectations that we were given. But they were always patient, they were always kind, and they always did their best to instill good values. And another person that inspires me, I don't mean to go too long on this question, is one of my mentors and one of my professors, Dr. Charles Alexander at UCLA. He sort of opened up the conversation and the idea about health disparities that exist in our communities, in different communities across the country and even the world. And so he's had so many connections, and he's had us meet with so many people to learn more about it.
Yeah.
And he's also such a really positive person that's really wholesome and willing to, go the extra mile to check on his mentees. And
Yeah.
so he's definitely inspired me to want to be a figure, that kind of figure for someone else later down the line.
Absolutely. And I think you'll be a great mentor to so many that are coming behind you. You mentioned something in there that your professor kind of exposed you to or kind of talked a lot about, which is health disparities. And again, we're in this season where, a lot of unknowns are happening right now. I'm just curious to know, what role do you think the medical field should play in terms of reducing health disparities, but also recognizing social justice as a public health concern?
Yeah. So I would say that medicine should be at the forefront in terms of social justice and health disparities. Because one thing about the medical field is that we're all about the health of our patients and ensuring their own wellness.
Mm-hmm.
But social justice is practically that, just building the the quality of life of the people who are involved. And so, we can't just stop at, okay, here's prescription, you have these diseases. We got to go beyond that. We got to be able to prevent these certain issues from happening. And not
Yeah.
only making sure that their like quality of life, their living situation is in a way that will be able to make them live their healthiest lives. So if we don't tackle issues like racism, problems with immigration, if we don't tackle sexism and various other issues, people's quality of life are just going to go down just because of that. And
Yeah.
if we focus on medicine, just like, okay, maybe you should try not to be so stressed, but how can we not be stressed with so many issues going on? And so I definitely think that social justice should be a priority if we really want to impact the health of our communities.
That's awesome. They're all connected, and I think at the faster we realize how interconnected things are, the more, solutions that we can have to kind of solve those things. As you enter into your medical school career, I'm curious to know what you're hoping to accomplish, throughout your medical career.
Okay. Yeah, I've also been thinking that, especially since I'm about to enter my first year.
Yeah.
And so one of the programs I'm in is also in the Prime program, Prime LA at UCLA and Charles Drew. And so what it sort of focuses on is addressing these health disparities and going into like different avenues of education to be able to build up skills and leadership opportunities so that you'll be able to impact the community. So one of the goals I have is to earn a master's in public health
Mm.
and sort of consider like what kind of community programs can I be a part of, what community programs can I may start in order to address issues that I feel is important or personal to me. So two issues that are particularly personal to me are cardiovascular diseases. This is especially prevalent in minority communities, particularly Black communities. And so have faced that in a lot of my community and my family. And so I definitely want to address those issues and see how can we improve the health of that overall, especially as quality of life overall increases. Heart disease still is like rated number one or one of the highest causes of death.
Yep,
And
yep.
another one is the issue of homelessness. As many people may know, LA has had a problem with addressing homelessness or people experiencing homelessness. And so I worked at the National Health Foundation, which houses individuals experiencing homelessness but also have health issues. And I was worked as a caregiver. I got to clean, to talk with them, to cook with them, and to get to know their story. And I think that one thing people tend to ignore is they think as one idea of what homelessness looks like, but they don't
Mm,
know sort of what their struggles are, that they're all individual people
that's
with
awesome.
goals,
Yeah,
dreams, and different other things. And so making sure that they can have a quality of life, high quality of life, and to be able to ensure that there's an option for them to be healthy and be in the right mindset overall. So that's definitely something. Those two issues are definitely personal for me.
absolutely. And um, they're very necessary issues to tackle. And I love that you have a heart for both of those populations. And I love that, you're already thinking, ahead, right? And what you
Yeah.
want to accomplish in your medical career, because it's so needed right now, especially when you bring up homelessness. We see that increase, and post COVID, we're going to see some different things as well. And so it's awesome that, you're getting in that pipeline and getting ready to go. So I love to hear that. We're going to take one more question from the audience here. I'll pin it here. It says, when did you first know you wanted to become a physician?
Okay, that's a pretty good question. So I first known that I wanted to become a physician was sort of around like after the time of when my grandmother passed away, and after being in the hospital and seeing, what the healthcare workers were doing, and sort of their impact, talking with the family, allowing them to be able to grieve when it happens, and just being really patient and kind with us. Sort of introduced the social aspect of medicine, in that it's not just seeing patients, taking these tests, and asking these questions, but going further and building that personal connections, making sure that even if they're not your patients, even if it's just the family of them, you can still be that human figure, and just you know ensure that they're comfortable as well, or do the best that you can, and address any other issues that are going on. And so, of course, there's like different roles in the healthcare fields, but I wanted to sort of have that interaction where I'm able to learn about the symptoms and the conditions, and to be able to do my best to address their issues as well.
Awesome, awesome. That's incredible, incredible. I know you're going to do some major things in the medical industry. Man, I'm excited for just hearing, after your 4 years, what you plan to do. So that's awesome.